You.
I'm good, Marilyn. How are you?
Good.
Good to
Hanging
see
in.
you.
Thank you. This won't be an all-night meeting, will it?
That's not up to me.
Oh,
If it were up to me, it would be 5 minutes and then dinner.
you're my kind of a guy. I like that. How are your dogs?
They know we just started, that people just started showing up, so they've just started to play. So they're about to get very loud.
Oh, good. Frisky. All right. We have a new dog park on Coney Island Avenue. It's pretty nice.
I know at some point I'm going to go check that out, but I'm not ready to do that yet.
No, but it's a nice little park. They had more land behind. They could have, all right, but at least they did something. Nice.
Is Parks they didn't put a dog run in Sunset Park, right?
No,
Say that again.
No,
Natasha was just asking about local dog runs.
Hi, everyone.
Hi.
Hi, Cynthia.
Hi, Cynthia.
Hi, everybody.
Oh, Cynthia's. Hi,
Hi,
Cynthia.
Cynthia.
Hi.
Hi.
Yeah.
Listen, I have a question. The question is that the presenters for tonight's meeting, there's supposed to be two of them. Am I correct?
No, one.
Just Aldo.
Oh, just Aldo. Okay, because I know that in the email, because I didn't know who the other person was. So,
Gotcha.
okay,
You weren't going crazy. Don't worry.
okay.
I love the closed caption. Aldo somehow became sourdough.
No, stop.
All right.
Hello, good evening.
Hi.
Hey, Aldo, how are you?
How are you, Jeremy?
Good
Doing
seeing
well.
you.
Nice to see you. Nice to see everybody.
Hello.
Pat, how are you?
Hi.
Good, how are you, Aldo?
Very well, thank you. I see
Hi,
Natasha.
Cynthia and everybody.
Oh, hi.
Cynthia, just when you start the meeting, you need to ask me to call the roll.
Absolutely.
Great.
Oh,
And I have 5:59. We're already live on YouTube. I'm going to open up in a minute.
Okay, we have enough people at this point to begin, so.
Yeah, it's not 6 though on my clock though. And we
No, it's
haven't let,
not. We still have
haven't let
2 minutes left.
we haven't let the attendees in yet. So the meeting
Oh, I
hasn't
see.
opened. I do
Okay,
that at 6.
okay, good enough.
And my phone says 5:58, but I always go by the computer.
Yeah, mine says the same.
everyone.
Hi, Beverly.
Hi.
oh, excuse me.
Hi, Joan. Hi, Pat. How you doing?
Hi, I'm tired. I'm
Let's get
tired.
a morning chain now.
All right, I've got
Yeah.
6. I'm going to open up.
All right.
Okay, so Jeremy, could-
Hopefully, we'll start to see the attendees list populate over the next minute or so.
so let's wait till the 6 o'clock hour and then you can call the roll.
Okay.
Whatever you guys want.
Yes, huh, don't look so serious. You're scaring us now, you're scaring us.
Sorry, I just got off of a work call and I'm just like, my head is like spinning.
All
Now-
right.
We're used to the smile.
Oi. How are those tacos, Cesar? I was thinking about them.
Stop it. Some of us haven't had dinner.
I know.
Thank you,
I'm
Jeremy.
looking for leftovers.
I know. Yeah, no chance. With my 2 boys, they eat like
Piranhas.
the big one in particular is going through a massive growth spurt because like he just eats like
Wow.
Not meal all the time, which is like fascinating to watch because he's like this skinny. It's like ridiculous.
My granddaughter's the same. She eats and eats and just
Oh my God.
skinny as shit.
When they stop eating, that's when you have a problem. Okay, Jeremy, can we do the roll call?
Sure, absolutely. I'm going to mute everybody right now.
Good.
All right, board members, I am going to call your name. If you are on the health committee first, please unmute yourself and let me know you're here. Afterwards, I am very quickly going to read the other names of board members who are not members of the committee, but who are here. So we will start with Cynthia Gonzalez. You need to unmute yourself, Cynthia.
Present.
Thank you. Pat Ruiz,
Here,
Griselle Amador, Joan Body,
Here.
Cynthia Felix,
Present. Hi, everyone.
Anthony Gilio. Not being unfriendly, Cynthia, just got a job to do. Christina Lem. Aurelius Martinez. Gloria Rodriguez Navoa. Cesar Zuniga.
Present.
Okay, we've reached the end of the committee. I am now going to read the board members who are in attendance, but who aren't committee members. So I have Beverly Kleinman. I have,
Present. Okay.
thank you, Beverly, but I'll point out you don't have to call present since you're not a committee member. Hector Gonzalez. Joan Body. Oh, I'm sorry, Joan, you're a committee member. John Johnston. Karen Rolnick. And Marilyn Melman. And you can take it away, Cynthia.
Let me unmute myself because I always forget to do that. First of all, good evening, ladies and gentlemen. The Health and Mental Health Committee thanks you for your participation tonight. We look forward to sharing mutual feelings, concerns, and questions as they relate to the hardships brought on by COVID-19. Many concerns relate to the behaviors, emotional toll, and physical hardships of people in our district. Also things around behaviors, you know, mask wearing, which people are still resistant to doing, social distancing, just, everything that goes along with it, having to remember to clean your hands and disinfect things. All of this is very new to our society. So, of course, remembering to do these things, especially when, you've had trauma in your life, the loss of loved ones like I have. Many of you know that in 1 month I lost 3 family members, and I'm still not over that trauma. And it's been a year. It's been a year since that. So, the massive testing and contact tracing, when you're contacted by one of these people that come around to inform you that somebody you've been with has COVID, all of these things, it's a lot. It's a lot. And on top of that, people worrying about insurance, especially if they don't have any, people worrying about housing eviction, even with the moratorium, because they know that when it ends, I think it's at the end of this month or next month or something, people are going to have a massive bill to pay, and maybe they're unemployed. Just the emotional toll, the fear, the losses, food insecurity, which people still experience. Now, all of these things we address these things in the Mental Health Committee in July of last year. And we did it just for the board and so that people can voice their concerns and stuff. And, you know, it's almost a year after that now that, okay, we have the vaccine, you know, there's hope in sight and all of that. But as a licensed clinical social worker that did psychotherapy for 26 years of my life, okay, until I retired, I understand very well that trauma is something that lasts and it goes on and on and on and on. And especially when it involves the losses, the loss of your employment. Maybe you were employed in a place for 20 years and all of a sudden now you lost your job and maybe there's no going back. You know, what do you do with yourself? All of these things have a great impact. Also, I'll add to that the fact that those of you that have children who are not accustomed to homeschooling, you know, who are used to being socially active, you know, they've been more socially active than us since they were born. So, you know, the loss of that. And it's very, very, very difficult for children to not get the help that they need in these times. And the second thing is that which comes to mind is that now everything is telemedicine. It's not like you go to your therapist and she's a real human being that's right there next to you, you know, providing support. And, you know, now everything is remote. It's almost like to develop a relationship remotely where, you know, maybe the physical body language is very extremely limited, you know, all of these things sort of like impair the therapeutic relationship. So tonight we have Aldo Cano Trevino, who is with us. Hopefully he can, you know, in his presentation address some of these things and more. Excuse me, more than that, what can we do about it? What resources are available to us? Thank you, Aldo, for being with us, and I'm going to turn it over to you.
I'm sorry, before I start, because I don't know that I'm going to be able to stay for the whole meeting, but I just wanted to quickly say a couple of things. Cynthia, first of all, thank you. Thank you so much for creating this space. We are so indebted to you because I think you're absolutely right. We are all going through such difficult times right now. And I think the more we're able to support each other as neighbors and as a community in these kinds of spaces, I think the better it is for all of us to like really figure out a way of moving forward. And Aldo, I can't say enough about just how much I appreciate your work as well. You know, I think the pandemic has really laid bare a lot of the inequities that I think a lot of us who have done the work, whether it's in healthcare or education, have known and have known that they've existed for a long, long time. And I think, you know, when we look at what's happening in our community, it really is sobering. Not surprising, obviously, because again, I think a lot of us who have been in the work know and have known, but it's sobering. And, you know, I just lost another family member last week. I found out today. And it just reminds me that on top of lots of other lots of other risk factors to pile on top of that, this massive pandemic that we've all been struggling with. Again, I think it just reminds me of the need for us to like really be there for each other. So again, thank you, and thank you everyone for coming tonight and for being part of this. And I think as we move forward, there's so much information that's coming out that's relevant to in particular now the vaccine, that I think we really need to come together as a community to make sure that we're amplifying good, reliable information, because I know that there's a lot of fear, a lot of anxiety out in the community, and we just have to kind of utilize this platform to like really help people try to make sense of the overwhelming amount of information that's coming in. So Aldo, thank you very much, and with that, I'll turn it over to you. Thank you.
I just want to briefly note, I noted the attendance of Griselle Amador, Victor Swinton, Alexa Aviles, and I believe that's everybody else. Yes. Okay. Thank you. Oh, Cindy Vanderbosch. Sorry.
Great. Well, thank you very much for the committee to giving me this time to invite you to the program that we have been offering to communities that have been affected disproportionately because of COVID-19 to our mental health. And Cynthia, Cesar, thank you very much for your words. And my heart goes out to all of everybody in our community that has been affected and disproportionately affected by COVID-19. And let me just give you a general my name is Aldo Cano, and I am from Sunset Park as well. I live here in Sunset Park. And I work for the Department of Health. I'm an outreach coordinator, and we're a very small unit, and we could be like, we're considered, I guess, the educational component of our unit. And we provide free training and presentations on mental health wellness. That is our unit's purpose, and that's how we approach our community and bring them information, vital information, resources that are available to them. So this, the reason I'm here today, and I asked Jeremy if I could address your committee today, and I thank you very much for allowing me to address you today, is because I want to partner with all of you, with each individual that is here. I want to partner with you so that we can bring this presentation that I'm going to talk to you about to our community. We have been working in Sunset Park. We bring it to a Center for Family Life, for example, OLPH, Visión Futuro, which is a small, you know them as a group of parents, concerned parents, also with Gloria Zúñiga in United Volunteers for the Community. So we have been reaching out to different communities and communities of faith as well. So what I am seeking is to increase our reach in Sunset Park, in Red Hook, in all of our district, so that we have this vital information. We can bring this information to all our community members. So let me tell you a little bit about what the presentation is about. And we are, I don't know if you remember, our main program was mental health first aid training. Some of you took that training, which was an 8-hour training. It was an in-person training, and it was designed to help people identify the signs and symptoms of mental health disorders so that we can help our community create resilience, empower our community by helping each other. So this goes along with that, but of course we had to modify. So that program is on pause because it's an 8-hour training, but we developed a presentation that is 1 hour in length. And we have another training that is 3 hours in length. So you have a choice if you want to bring a presentation about COVID-19 and its effect on mental health, or a training that will be 3 hours in length. So that is and it's all done online, and it's all with 2 presenters. These are our trained presenters. Cynthia mentioned that she's a social worker. A lot of our presenters are social workers. I am not a social worker. My background is education. So we have a combination of our trainers being in the education field or in social work. So very experienced people that are capable of assisting people that might be going through, that have urgent questions and that might be affected by what the topics that are talked in the presentation. So I am going to quickly, is it possible to share? It's a very short presentation. Is it possible to share a presentation, Jeremy?
Yes, I just have to make you co-host and then you can share your screen, all right?
Okay, I just want everybody to, so that we can follow.
You should be able to share your screen now.
Okay, perfect. I just want,
Great.
so that we can just follow together. So this presentation is called COVID-19 Community Conversations, Mental Health, Equity, and Resilience. And that's the main topic, and that's what we're going to be talking about. So we talk about how it is, COVID-19 is a shared traumatic experience. We were talking about trauma. We talk about historic trauma, which is very important. It has to do a lot with health disparities in communities of color. So we talk about that. And we call it a community conversation because it's a 45-minute presentation. This light is kind of, it's a 45-minute presentation. And then we go to a 15-minute to a 45-minute Q&A, depending on the dynamic or how much people are participating. So we're open to just being 50 minutes or 45 minutes. And we talk about the topics that we had just talked about. So we address mental health that has brought on by COVID-19, structural racism. And so we provided this 1-hour informational virtual presentation. So what will participants learn? We will talk about COVID-19 impact on mental health, health disparities in communities of color, the effects of trauma, grief, and anxiety. So we talk a little bit about including historical trauma that we talked about how, I think it was mentioned today by Cynthia in her introduction, how generations have been affected and trauma continues with especially communities of color, LGBT communities, etc. And then we talk about coping skills. So this goes in line with our mental health first aid training. How can we cope with this? We talk about mental health resources that are available in New York City, which is, the main one is NYC Well, which is 24/7 call line that people can call. People can go through the internet. They can also text. So there's a lot of different ways to be able to communicate with professionals, social workers, etc., that will be able to guide a person if they're going through crisis, or if they have questions, if they're trying to find services that will be long-term, because this will be short-term. So we're trying to connect the community with resources. And we not only talk about mental health, NYC Well, but there's other resources as well that we, at the end of the presentation, we send you an email with all of the resources that are available, including resources that are relevant culturally, that people can identify and feel comfortable, because we know that there is stigma attached to reaching out to mental health resources. Specifically for example, in Latino communities, I come from Mexico, so I know that how do we view a person that is seeking help, right? Or how do we see a person that might show signs and symptoms of depression, but then we go, oh no, es un flojo, right? no quiere hacer nada, se la pasa ahí, this person doesn't want to do anything. He's in the room all the time. He's just so lazy. So we attach a lot of labels. There's a lot of stigma attached to mental health because we don't understand the signs and symptoms, right? So this is, for those who already took mental health first aid training, this is a refresher for you. For those who have not, this brings a lot of resources to you in a very short time, because we know that everybody's going through a lot of stress in relation to Zoom, right? Zoom fatigue, it's been called now. So we have to make it short, but we also have a training that is 3 hours. So that's going to be a training that they will receive a certification of completion, and it's more extensive. It takes more time. It has more activities that are interactive. But this one is very compact and brings all the information. So give me 1 second. So the logistics and details are very practical. These presentations and trainings are available any day of the week, including Saturday and Sunday. We do have time slots because that allows our trainers to be optimize our time. We know we're in a tight budget, so we can plan with you and your organization. You just tell us, listen, I have a group of X number of people. We want to do it this day, and I think the 9:30 a.m. is a good slot because that's the start of the day. Or let's do a 3:30 p.m. to 5. That works out with me. If you see that this is not a good time for your group, we can try to find an evening schedule for you. We understand a lot of people are also working from home, or people are, first responders and they're actually, working outside of their homes. So there's a way that we can try to find a schedule for you, but I would need 2 weeks advance notice because it has to go through different approvals. So, and each session will be facilitated by 2 of our presenters. It's also available in Spanish. It's also available in Cantonese and Mandarin. So and other languages, but with the interpreter system that we have. So we ask, because we are optimizing our service, we have a cap of 30 people. We understand that 30 people is the maximum that we can have in order to have a good interactive, and also to be able to answer questions in a small group is much practical. But we do ask that you could guarantee, if we're between 10 and 30 people, that's ideal. That's great. It would be amazing. As you know, with all the meetings, so we do hope that people can, in order to get the best effect of the presentation, if people can turn on the camera or view the presentation, that's going to be most effective. But we also have dial-up available. And then online meeting platforms, we use WebEx, which is the one that's most available in the Department of Health. But if your organization has a different platform that you use, and you know that your constituents or your group feel comfortable with that, definitely we can use your account, your Zoom account or your Meet account. But you would need to allow us to do the co-host, just like Jeremy did, gave me the co-host ability, so that we can facilitate also the chat, because one presenter is doing the PowerPoint presentation, and the other one is checking with people on chat if they have questions and answering questions as we go and as we reach the Q&A as well. So then the way that we work in terms of how do people register, how do they get the link so that they go to the presentation. So we also provide you with a flyer just like this. I brought an example for you to see, and you can see that we include the registration right there at the bottom. And the registration steps are easy. Once your group, you decide you want to bring this to your group and you decide the date and time, we send you a confirmation and a registration link. And that registration link you share with all of the people you want to invite. They go to the registration link, they choose a session, which is the date and time, then they click on next, and then they fill out the application and click on submit. And that's, once we have their email, then we'll be able to send them the WebEx registration with reminders. Now, some of you work with communities that might not feel comfortable registering. They might not want to do that. It sometimes feels difficult for them, or they might not trust the source. So I can work with you in that way. If we want to work with a list that you want to provide, we can do that. I just need their name and their email so that we can send them the resource list. So that would be a way to provide that. So just to recap, I'm reaching to you as community leaders, as people who are have a relationship with other organizations that you would like to bring these presentations. They would like to have people have this conversation about how we are affected in terms of our mental health, information of how communities of color, how there has been a very disproportionate effect in communities of color, including Latinos. So this, and then talking about the different resources that are available to them. I have to tell you that I used to be a smoker. So it took me many times trying to quit and sitting in presentations about smoking and people telling me. And so being reminded that there are services out there, that I could actually use that patch and maybe use it as a way to stop smoking. And then also to understand that it was part of my anxiety. It wasn't, one just thinks, oh, it's smoking is just smoking, but it's part of a mental health disorder. So I didn't understand that, but it took me several times until I reached out and wanted to stop. So the reason why I'm saying this is because people are hearing about mental health resources, but they're not reaching out. So we need to remind everybody that there are available. We need to have this conversation, the one that we're having at the end, where people feel related with other people, and we can talk about how we are grieving. We can talk about the different ways we are doing different ways of coping with our anxiety. And sometimes they're very passionate conversations that we have, very deep conversations that we have, and also humorous as we talk about ways that we're coping and how we are doing in our homes with our spouses and or family, or sometimes more difficult situations where we are living in a community or in a home where we're sharing it with 2 or 3 families. So all of that opens our hearts. All of that helps us have conversations. All of that brings seriousness about our mental health, which I know you all are very serious about that. But I just want to let you know that I've been at some of these presentations and I see great results. I see great communication. I see people that feel very grateful that we're talking about this. So I want to invite you. I want to really ask you to reach out to that organization, or if you have an organization, and let's organize a presentation. Let's bring them information. Let's have conversations, about mental health, and hopefully increase the amazing resilience of our community and increase it. I'm sorry, my voice is going, but I just want to just let you know how much I really think that it's such a healthy exercise and a vital exercise to bring information to our community. And I'm very grateful that you allowed me to be here with you and to speak about this. And if you have any questions, I'm open to helping out with any questions that you might have. So let me stop sharing. There we go. And if you have any questions, I'll be happy to.
I have a comment though on
Yes.
something that you mentioned earlier,
Mhm.
and that is regarding people who, the technical word that we use, because you had mentioned something about, when the family and everybody else, when somebody's impacted and they're depressed and they're anxious and they're just like moping around, and there's a term that we use, which is malingering.
Malingering.
The
That was new to me.
families, the families and everybody, around them, think they're just making it up. They're not really sick. They're not really impacted. They're just malingering. That's the term, the technical term that we use. And I feel that, given, the situation that we've gone through for the past year, it's easy to say that somebody is, they're malingering. Oh, yeah, they're not going back to work because they're getting more money on unemployment. They're not really affected. But because the lockdown has created a situation where our lives are not normal. It's not normal for anybody. And the younger you are, the less normal it is for you, because you lack the understanding of what is going on, really. And when you're young, people don't tell you everything. They just they tell you the least that they could, because they don't want to add more trauma or whatever, or they don't know how to explain what's happening. A lot of people, they don't know how to explain what's happening. So, I wanted to put that out because you mentioned it, Aldo. And it is important to know that, how do we differentiate malingering, which some people actually do malinger, from somebody who has really been emotionally and psychologically impacted by what has happened to them. Everybody's lives have changed. My life has been dramatically changed by all of this. I mean, I retired in the last day of 2019, thinking that, even though I'm a cancer patient, well, I'll go to the theater, I'll go here, I'll have more time to recover, from my illness, which, I'm still being treated for, right? And then all of a sudden, everything that I thought was going to happen never happened. All of the traveling I thought I was going to do never happened. My brother died and I couldn't be there to hold his hand because it was shut down. Everything was shut down. My uncle passed away. My nephew passed away. I couldn't go to see them and be with them like I normally do. And right now, at this very moment, I have a 75-year-old uncle in the hospital, who I can't visit. Oh yeah, I could go there and drop off a bag of food, but I can't see my uncle. I don't know what's happening to my uncle. I don't know the care that my uncle's getting. So all of these obviously are continuing to create more anxiety for me. I don't know what's going on. I cannot know what's going on because I can't be there.
Mhm.
So I hope to God that, I hope to God that, if my depression and my anxiety conditions, that people don't think that I'm just malingering, because I'm trying to recover from my trauma. But like Cesar, every time you hear one more of your loved persons are gone, especially if it's COVID related, and we all know that people that go into hospitals, that's where they get the COVID. They didn't go in with the COVID, but they died with the COVID. And, I just wanted to bring that out.
Cynthia, we have
Definitely.
one hand up and one question from the Q&A.
So I don't know how to do the
I'm
hand
more
up.
than happy to handle that if you'd like.
Thank you very much,
No
Chad.
problem. Alexa?
Hi, Aldo. Thank you so much for the presentation and the offer of partnership. Our community absolutely needs it. I was curious how much of the conversation can be dedicated towards young people, or is it skewed mainly to identifying some of these things in adults?
Yes. Thank you, Alexa. That's a great question because, our previous presentations were for 18 years of older because we talk about suicide in the present, not in the programs before, but in this presentation, we don't. So the age group is 13 years of age and older. So it's I love that you brought that because I didn't mention that youth, how important it is for them, and I think Cynthia also mentioned how important it is for them to be aware of what's happening in their household or what's happening to them, and they're not making it up. They get to understand that yes, they're grieving. They're grieving their family, their community, right? Their rituals that they do at that age, meeting with friends, graduations, all these, not being able to meet in after church or any meeting with their parents, so I'm so glad you brought that up, Alexa, because 13 years of age or older, they are welcome to come and participate in this presentation, and their input is very important. And so definitely.
And the resources that are going to be provided are also in consideration with that age group. Like they're specific, like I'm thinking, some of the outreach providers may focus more on adults and not so much on young people. So I'm curious how much of the resource there is available to support young people.
Definitely, NYC Well offers help to all New Yorkers.
Okay.
The only thing with NYC Well is that they do need an adult to call in. They have to be 18 years of age or older, I believe. So they would need, it's great for that relationship that you might have with a young person and say, I can make that call for you. Let's find you resources. I'm thinking for example, LGBTQ community, we talk about resources available for youth as well.
Yeah.
Yes, definitely, it's not just for adults. Services
Okay.
are also.
Yeah, no, I think anything that it will allow young people to access the services without parental permission, right? Which can be a barrier, right? Because some young people don't want their parents to know, don't think they'll understand, or that can pose a real challenge for accessing services. So to the extent we can have direct access for young people to get the support that they need is super important. So thank you.
Thank you.
I have another hand up. I will remind folks, please use the raise hand function. Both panelists and attendees can do that. We did also have a question in Q&A, Aldo, from Rosa, who asked, do you have to be part of a group or can individuals also register?
Great question. Thank you so much. So yes, well, I definitely yes. They're called open presentations. We have several presentations in each borough. But because they're virtual, I think it's just for the whole city. But these are presentations where people, and I'll share the links with you on the Q&A or on the chat right now. So these are all links where you can link on that and just find a date and time if you just want to take it yourself. And I'll do that right now. But I always recommend a group. If you can organize a group, or if you can acercarse, reach out to another group and let them know, listen, there's this community conversation about COVID-19 and mental health. It's short, it's 45 minutes with 15 to 30 minutes. If you can bring the whole group, because I've noticed that the dynamic when everybody knows each other and they have this trust, the conversations are so much open, and people tend to feel more comfortable in talking about specifically grief, and then talking about their own depression. I think we're all have, one of the things that we talk about is that if it's 2 weeks or more where you've had this, the blues, if it's for 2 weeks or more, then you're going into depression. And I think that every one of us in New York City have had this feeling of depression, anxiety. So it's really important. Yes, definitely.
Sorry. Thank you, Aldo. Excuse me. I have Griselle Amador next.
Aldo, thank you very much for all that information. Thank you. I had the honor to meet you before, so I thank you very much for everything you have done for United Senior Center. Good that you say that you're going to provide the link for the additional trainings and meetings. I've been participating in some because they put it all together for the month. And then from there, you choose which one you want to participate. So I participate in some and are very, very good with excellent information. I just want to say thank you very much, okay? Thank you.
Thank you, Griselle. Greatly appreciate when I, working with you and with seniors.
My honor. Thank you.
Thank you. I'm going to look for those links right now and post them.
You would have to post it in our Q&A. We had to, unfortunately, get rid of the chat.
Okay.
If you could email them to me as well, we'll put it out on our social media accounts tomorrow.
Perfect.
I don't have any other hands up. Cynthia?
I have to unmute myself. I always forget to do that. Well, if we don't have any more questions, first of all, I want to thank Aldo Cano Trevino for having come and done this presentation, and any information that he sends to us through the Q&A. I'm hoping to gather that information and send it out to all of the parties concerned and to the organ, so that people with, that are connected to organizations such as myself can avail themselves of this opportunity. So I don't know if there's nothing else to say. I just want to thank everybody that participated tonight. And I hope that the information that is forthcoming is beneficial to everybody that attended here and to those that didn't, especially to those that didn't. And I also want to announce that, and I want to send a thank you to Paul Mack, who I reached out today, and he was able to get me my appointment to get my first vaccine, because I really want to be, a participant in that also, and, to reduce the risk of everyone, and to myself, of course, and maybe, come, in the months to come, we will have a little bit more freedom, even though I know that Anthony Fauci has said that we'll probably be wearing masks well into next year. So, but I think for me personally, the mask is the biggest thing, because even though I have it, sometimes it's hanging on my neck and I forget to put it up. It's an issue. So I hope that we're going to see the end of this. And I'm praying to God that the next health and mental health meeting isn't related to these mutated COVID situations coming from the UK and other places, because that's another thing that threatens to keep this pandemic going on. And I'm hoping that, given everything that we've experienced in the last year, that we're one step ahead of it this time, and that this does not happen, and that we will see the end of this pandemic soon. God bless you all. I pray for you every day. And I hope to God that we can get together. I miss you all.
Folks, I'm going to leave the Zoom meeting open for a few minutes. Hopefully Aldo will be able to post the information in the Q&A. So take a couple of, I think Aldo wants to say something.
Just Jeremy, I want to say that I put it in the Q&A. I don't know who did I send it to? I probably sent it to Rosa Sarabal. I'm not too sure.
Can you send it to us?
No, it's actually in the Q&A. You can see it under answered questions.
You can.
You put the links for each of the
Oh,
boroughs.
I see. Yes.
Yes.
Okay.
Okay.
So I'm going to leave that open for a few minutes so folks could take their time to copy that. And Cynthia, you just need to declare the meeting over.
Oh, I'm sorry. I forgot to unmute myself. Good night, everyone. Be safe and take care of yourselves and your families. And I look forward to seeing you soon. Thank you all for attending.
Good night.
Good night, Cynthia. Thank you so much. Thank you, Aldo. Good night.
Thank you, everybody. Thank you so much, Cynthia, everybody. Thank you.
Thank you, everybody.
Have a good evening.
Thank you, you too.